Okay, this is going to be your video for your second competency assessment, and this will be the laparotomy version of the setup. So you'll have, for competency assessment 2, you will get either the laparotomy setup or the laparoscopic setup. Okay, you won't know when you come in which one you're getting. So this is your laparotomy video. So it's going to start just like your competency assessment number 1. So giving myself room, start in the middle. First fold is away. Make sure to give myself space. Stay on this side and do my gown since I'm over here. Wrap is good. This is why I say you have to use 2 hands, because when I just start flipping back up, you gotta be able to pull them both down. Okay. Finish that, I'm over and do my basin. Check for my filter, check my indicators. Good. My hand over the arrow. Open it like a hot pot. Check my filter, and it's good. All right, so again, you have a little bit more to open this time. So again, I'll just start with my towels, starting with the first flap away from me, holding on to all your corners. And it's good. And that's awesome because I can see my indicator, so already at this point I know that it's good. You'll have lap sponges to open. With my wrapper for holes, and open it just like my towels. Check the holes. Raytex sponges. Check the holes. Open suture again. No holes there. And then I'll have my 2 pairs of gloves. And then my second pair on my nail stand, or my undergloves. So I have a 1-inch margin there, so I'm going to say that it's good. Okay, so then I'm going to go out and do my brushless scrub this time. So we're just going to pretend that I've gone to do it, okay? And I'm going to come in dry. You guys can reference the brushless scrub video if you feel like you need to watch that. So I would have done my brushless scrub, come in through the door, and now I don't need my towel because I've done the brushless scrub, my arms are dry, okay? I'm going to go ahead and pick everything up all at once and go ahead and just get rid of my towel there. Again, holding onto the armpit, going forward, hand on the belly. Okay. So look how high the neck of my gown is and where my hands are. Okay, that's what you guys should look like. Your hands should not be up high close to the neck of your gown. Amy ties me. I'm gonna come on in again. Look at how far away I am from my nail stand when I'm grabbing. Again, I like to do my left hand first, keeping my fingers out of the white cuff. Okay. Come in from far away, get my glove back out, and I'll ask my circulator to check my wrapper while I'm getting on my second glove. Wrapper's good, okay? I'm gonna pull my left tie out, hand her the card for my right. She's gonna come around behind me, and I'll tie. All right, then I'm putting on my second pair of gloves. So I have my indicator here that I would check. Put my towels where I want them. Get my trash out of the way here, and I'm gonna come over and grab my instrument pan. I'm making sure I'm staying 12 to 18 inches away, going straight down with my arms, okay? Grab my instrument pan and ask my circulator to check my filter, holding my pan away from me, not letting it touch my gown. Filter's good, right, thank you. Set it where I want it. Okay. So at this point, you guys can really do whatever you want. Since I'm standing right here and my basin's right here this time, I'm gonna go ahead and just grab my basin and put it in the corner since I was there. Okay. So I need 3 towels for my corner here. I need 2 towels for my mayo stand and 4 for squaring off. The rest I'll use with my surgeon's gowns and gloves that I'm going to go ahead, since I'm touching it, put it where I want it, okay? I have my mayo in my trash, it's going to go over there, and my 4 towels and my drape can go in my basin. I'm going to go ahead and drape my mayo stand. Again, the cuff came out, so I'm just going to switch to side and ask my circulator to fix my cuff for me. Thank you. First towel away from your back table. Second towel closest to. Again, taking the tabs off, just keep them in my hand, throw them away, and stick my trash on. Now I can lay my towels down in my corner here. Notice when I lay these down, I pull them from the back. Some people will do this, and look what happens. So my towel was below my table level. So I go from the back and pull it forward. Okay. Got my sponges. I can set here and my suture. I'm gonna make my roll towel. Again, you can use 2 towels, you can use your glove wrapper. However you want to make your roll towel so it holds your instruments, okay? All right, next I'm going to go through my basin like before. Put my suction, pottery, light handles. Got my scratch pad I'll put with my pottery. I have ties that are going to go underneath my towel, okay? I have suture that I'm touching it right now, so I'm just going to put it in order. So I have my procedural stitch that will go first, which is your big pack. And then you should have peritoneal, muscle fascia, sub-Q, and skin stitch. So you're going to want to put those in order, okay? All right, and then the suture that you opened is just going to go at the very back. All right, we just kind of, we know it's not part of our suture that we're using. Grab your needle book. The foam side goes furthest from where you're going to stand on the mayo, furthest from your back table, and you'll put the other one, the magnet side, on your back table, okay? Knife holder closest to the back table with the knife ends coming out towards your working corner of your back table. Put my amethyst basin next to my big basin, put my other 2 here, and I'll put my peanuts and my med cup right there in my working corner as well. Okay. I have all that organized. Now I will move on to my instrument pan. So I'm going to take my indicators out and just stick them underneath. Oh, my stringer came apart. Okay. So I'm going to lay down my stringer. You want the smallest instruments towards your working corner, which means your mosquitoes are going to be on the end closest to your working corner, okay? Now my stringer came apart here, so I'm going to have to adjust things a little bit here. Get my stringer out, and then I'll just take it and put it underneath my instrument pan. Okay. Alright, so then I'm going to start going through my instrument pan. I like to stand here and get out as much as I possibly can all at once, instead of going back and forth and back and forth. So I grabbed all of my forceps that I can see. I put my Army Navies on one of the handles, I'm putting my bands on the other handle while I'm standing here. Get my Balfour out, stand it next to here. Get my knife handles out and put them in my hand. Got my suction, then get out. And my Balfour blades are going on the edge of my pan here. Okay. I always put them inside the pan, so if they fall out, they're not going to fall on my table and onto the floor. They'll fall into my pan. Okay. Don't forget your yank howler tip that goes along with it. It should not be loaded on your yank howler. Okay. And then I stand my retractors up on the edge. My rakes as well. And then my Balfour blade needed to come out. Okay. So I'm putting my sends and my rakes next to each other. Everything's organized and easy to count. Then I'll come over, I'll put my knife handles in my working corner, and then I'll take my forceps and put them down in pairs. Okay. Only touching them this one time. So I didn't come in here, set down my whole pile and picking them up all again. Okay, I'm doing it all at once with touching them the minimal amount of time as possible. Okay. That means I am ready to count with my circulator. So I'll ask my circulator to count once I have everything organized on my back table. Okay? All right, so I'm going to make sure my circulator comes where she can see. So I'm going to ask my circulator to come on over to my right here. Start with our lap sponges. Okay. I'm going to break my finger. Okay, so laps, 1, 2, 3, 4, 5. My Ritex, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Peanuts, I'm going to pick up something to count. 1, 2, 3, 4, 5. Okay. And once I'm done with my sponges, I'm going to go on to my needles. Okay. So I'm going to start with my biggest one. So 1, 2, 3, 4, 5, 6, 7, 8. I like to fan them out. 9, 10, 11, 12, 13. Okay. Put them back in order. All right, then I have sharks. 13, 14. Okay. Then I'm going to move on to my sharps. So I'm going to count them all together. So my hypo is 1, 2, 3 for blades, and then 4 is my cautery. Okay. While I'm here, I also have 1 scratch pad.
1.
Okay. All right, so I've counted all of my soft goods. Now I'm going to move on to my instruments. So we start with our stringer. Okay. So mosquitoes. I have 1, 2, 3, 4. Kelly's 1, 2, 3, 4. Mayo's 1, 2, 3, 4, 5, 6. Alice 1, 2, 3, 4, 5, 6. Coker's 1, 2, 3, 4, 5, 6. Babcock's 1, 2, 3, 4, 5, 6. Addson tonsils 1, 2. Right angles 1, 2. Ring forceps 1, 2. Needle holders 1, 2, 3, 4. Scissors 1, 2, 3, 4. And towel clips 1, 2, 3, 4. Okay, so that's my stringer. You guys can move on however you want. I like to try and kind of go in a circle. So I go from my stringer to my forceps. So forceps. Yep. I have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. I'll come here. I have suction. 1, 2, 3, 4. And then retractors. So I have handhelds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. And then 1 self-retaining. Okay. Come to my Balfour. I have 1 body, 1 nut, and 1, 2, 3, 4, 5 blades. Okay. And then last, since I was holding my knife handle, 1, 2 knife handles. Okay. Don't just say 2 knife handles, you gotta actually count them. Okay. All right, so once I'm done counting, now I can start setting up. So the first thing you wanna do is load your knife blades. Okay, so just in case an emergency or your surgeon comes in early, you have knife blades loaded and ready to go. Since I have the needle holder in my hand, I'm going to go ahead and load my first stitch. Okay. Not waste that motion of having the needle holder. Load my first stitch. Put it on my Mayo stand. Okay. All right, next I'm going to come on to my stringer, and I'm going to grab all of these at once, clamp them 1 click as I put them in my hand. So I need 2 Kellys, 2 Mayos, 2 Alice's, 2 Cokers, and 2 Babcock. Okay. Then I also need to come down. I need my scissors. I need my Metz, Mayo, and suture scissors. Okay. I'm gonna come on back to my forceps. So I need my tissue forceps with teeth, and I need my medium DeBakey's, not my shorts. Okay, medium DeBakey's, and then I need my Army Navies. Okay. I'm gonna go ahead and put my Army Navies in the middle. I want my forceps on the side closest to my surgeon. I don't care how you do it. You can either nest them together or put them right next to each other. Up to you. I don't like them nested, so I'm going to put them next to each other. Okay. Put my scissors down, and then put my ringed instruments on the opposite side with the smallest ones towards me. Okay. All right. So then I think I'm ready for loading my right angle with a tie, which there's probably a loose one in your pack. If not, you'll take one out of your tie that's loaded on your, that you put underneath your towels here on your Mayo stand, okay? But you might have one free. All right. Okay. So then I can keep going with my accessory duties. So I'm going to take a Mayo clamp, long Mayo. I'm I'm gonna load my peanut on there and just set it on my stringer, and then I'm going to take a sponge and make my sponge stick. Set it here as well. Okay? Alright, so then next, I'm gonna need to get my fluids. Okay? So can I please have, why don't you give me saline first, please? Watching my back to my back table.
I have 0.9% sodium chloride for irrigation at 500 milliliters, and it expires September 2023.
All right. Thank you, that's good. All right. Well, she's giving me saline. I'm gonna go ahead and write 0.9% saline, 500 ml. And I'm gonna write that twice since I need to do my asepto as well. Okay. Go ahead and label my pitcher and label my asepto. If I have it in my hand, I may as well double load it. Okay. I'm gonna put it in my emesis basin. Can I have water, please?
Yes, I have sterile water for irrigation. This is also 500 mLs, and it expires September 2023.
Okay. Alright, I'm gonna label that water, and then I need my local.
Okay. I have 1/4% Marcaine with epinephrine, 1 to 200,000 units. I'm gonna give you 30 mLs,
Okay.
and that expires April 2023.
All right, thank you. All right, then I'm going to make my label for my med cup. So 0.25% Marcaine with epinephrine. You have to write out everything entirely. 1 to 200,000. And 30 mLs. You need to write that twice. And you're gonna feel like it's taking you forever. Alright, I'm labeling my med cup, labeling my syringe, load my syringe, get my bubbles out, put on my hypo, and go ahead and put this on my nail stand, okay? So other things I still need to do, I need to do a wet lap sponge. Okay? Use 2 hands to wring it out, otherwise it's more than likely gonna be too wet. Open it all the way up. Fold it in half, right, and just make sure that my end is hanging out, okay? Sorry, your asepto should go in your pitcher, and your wet sponge should go in your emesis basin, okay? And then the last things I need to do still is load my blades. So I'm gonna say I have a fairly skinny patient, so I'm gonna put on my short blades onto my valve bore. Okay, I've got that done. Now I need to put all my stuff onto my mayo stand to have it ready. I'm gonna put my suction together. of the loops here. You can send it out as long as your arm. I'm gonna grab my towel clip and stick it on where I want it. And take my cautery, get this ready with one extension. You texted it, Casey, name. There. Okay, and then also put a towel clip on here to have it ready. And then I also need 2 lap sponges on here, as well as my 2 light needles. Okay. So that is my back table completely ready to go, and my Mayo stand. Oh, and I'm gonna take my Adsons and put them over here in my working corner, so they're ready when it's time to close. All right, so now I'm ready for my surgeon. All right, so I'm ready for my surgeon to come in. I'm gonna go ahead and grab my gown and gloves. Hello, doctor, my name's Laura Stallings. I'm a surgical technology student at Southeast Community College.
Glad to have you today.
Again, while they're drying their hands, I'm gonna go ahead and get my gown ready, watching my back to my sterile field, cupping my hands and only going up to their shoulders. While my circulator's tying the back, I'm gonna expose my surgeon's hands. And my surgeon is right-handed. I'm gonna go ahead and get their right glove on, making sure all my fingers stay cuffed. They can assist with the second one. Okay. I'll ask my surgeon to tie, ask them if they'd like to dance. Again, I'm going to take the tie and my tag in my right hand, pull the tie out and hand them the tie with my left hand, okay? Take my track, put it wherever. So your surgeon is going to end up walking around to the other side of the field, and you're going to pull up your ring stand. So again, make sure you're not putting your back towards your sterile field, you're touching your ring stand on the top, and you're not bringing it too close to your sterile field. Okay. We waited our 3 minutes for our prep to dry. Okay. I'm gonna cuff all my fingers, come on up, and drape. So we're gonna pretend that your surgeon is a resident and they have no clue what they're doing, so you guys are going to have to drape all by yourself. Okay? I'm always watching my boundaries, how far away I am from the table. When I'm doing this, notice how far away I am. If I feel like it's too close, I can pull my blue towel away, okay, but I can never move it closer. And now I need to go around the other side, so I'm gonna push my basin back towards my sterile field, watch how close I'm getting, and walk around to the other side, making sure I'm not walking too close to that first corner, and do my last square off towel, okay? Again, watching my corners. I'm gonna come over, grab my drape. Surgeon, would you like stickies on or stickies off?
Let's leave them on.
Okay? I'm looking at my picture. Go ahead and set this up here. Hand half to my surgeon. Okay. Extend our hands out. We're gonna go to the foot first. And make sure you cuff your hand all the way underneath. And then we're gonna come up towards anesthesia. Again, making sure your hand is totally cuffed. Okay. All right. Now I'm gonna go ahead and start pulling up. So I'm gonna grab my Mayo stand first. Go ahead and hand the light handle to my surgeon. Now I'm gonna put on the light handle and then aim it at the sterile field. Next I'm gonna take my cautery. I lost my scratch pad, the circulator. Can I have a scratch pad, please?
Sure.
Thanks. Hand off my cautery. So I want my cautery on the right hand of my surgeon. Okay. And then suction, go up top. My suction canister is over here on this side on my tower. So I'm gonna go ahead and hand my cord off. And if your drape has one of these little things, you can use that to whip it, okay? Make sure that stays. Put up my 2 sponges, one for me, for the assistant, one for the surgeon, and then I'm gonna come back and get my back table. Again, not reaching underneath the edge of the back table and keeping it away from anything unsterile. And grab my basin and bring it as well. All right. So then you're going to hand the knife to your surgeon. You're going to verify that the timeout has been done. Okay. I have my knife backwards, so I'm going to spin them on my male before I hand. Okay. Knife up.
Knife down.
Okay. You're going to pick up the knife, and then you are going to hand your first stitch for closure. Okay. Grab scissors, put them on the field, and then your circulator is going to ask you, or you're going to ask your circulator if you can count. Okay. We may end up throwing something on the floor to count. Circulator, can I count with you?
Yes, I'm ready.
Okay. So you're going to start at the field and work your way down. So I have 1 lap on the field, 2, 3, 4, and 5 is on the floor.
Yep.
Okay. Ratex, I have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And peanuts, again, I'm grabbing an instrument. I have 1, 2, 3, 4, and 5. Okay. Needles, I have 1, she's sewing with, up on the field. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. Then I'll do my sharps. I have 1 with cautery.
1, 2, 3, 4.
Okay, sharps. Okay, then I can move on to my instruments. So Kelly's, I have 1, 2. Or sorry, let's start with mosquitoes. I don't have any on the field. 1, 2, 3, 4. Kelly's, 1, 2, 3, 4. Mayo's, 1, 2, 3, 4, 5, 6. Alice's, 1, 2, 3, 4, 5, 6. Coker's, 1, 2, 3, 4, 5, 6. Babcock's, 1, 2. Babcock's always get stuck together. 1, 2, 3, 4, 5, 6. Adds and tonsils, 1, 2. Right angles, 1, 2. Ring forceps, 1, 2. Needle holders, 1 on the field, right here. Okay. 2, 3, 4. Scissors, 1 on the field, 2, 3, 4. Towel clips, 1 on suction, 2 on cautery, 3, 4. Okay. So that's all my stringer. Now I'll move on, again, going in my circle so I don't forget everything. So next I would do forceps, but 1 on field, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Okay, and then I'll move on to retractors. So I have 1, 2 on the field, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. 1 self-retaining. In my Balfour, I have 1 body, 1 nut, 1, 2, 3, 4, 5 blades. Still have my suction. 1, 2 on the field, 3, 4. And then the last thing I have is my knife handles, 1, 2. Okay. So once you're done counting, your circulator is going to ask you about your meds. So I have 1/4% Marcaine with epi, 1 to 200,000. Okay, so my Marcaine is a local anesthetic for numbing and pain relief, and epinephrine is a vasoconstrictor to help with bleeding. And then you're going to have to give us 5 duties that you would do for cleanup at the end of your case. So it would be mopping the floor, cleaning up my instruments, putting them in the dirty basket, taking trash to the trash, linens to the linens. Okay, I think that was 5. Okay, and then you are done.